Okay. Bonjour tout le monde. Hello everyone. Sorry to be late. Et merci de vous être rejoint à nous aujourd'hui. Je m'excuse pour le retard et merci pour patienter. I'll start with our daily reminder to Canadians. We must practice social distancing. Please stay at home unless you are doing essential work like stocking our grocery shelves or working in healthcare. I know that this is really hard, but this is our country's best defense against this global pandemic. Please keep it up, everyone. Je vais commencer par mon rappel quotidien aux Canadiens et Canadiennes. Nous devons pratiquer la distanciation physique, rester à la maison, sauf si vous effectuez des tâches essentielles comme le stockage d'étagères d'épicerie ou des soins de santé. Je sais que c'est difficile, mais c'est notre meilleure défense contre le virus. Ne lâchez pas, s'il vous plaît. So, today we will hear from Canada's Deputy Chief Public Health Officer, Dr. Howard Njoo, and mon cher collègue, le président du Conseil du Trésor, Jean-Yves Duclos. Dr. Njoo, please.
Hello, bonjour tout le monde. Globally, there are over 530,000 cases of COVID-19 affecting all countries. In Canada, there are 4,043 cases, including 39 deaths. These are based on up-to-the-minute COVID-19 laboratory testing results. But it is important to know that at any point in time, there are many other people under investigation, awaiting laboratory tests, or not being tested at all. For this reason, even if you are not hearing of cases in your community, it doesn't mean there are no cases or that there are no exposures waiting to happen. We have now tested over 165,000 people in Canada, which is more than 65,000 additional people tested since Monday. On a per capita basis, that's more than 4,300 per million population, one of the highest rates in the world. In terms of the severity of COVID-19 in Canada, the percentage of cases that require hospitalization remains at about 6%. Those who are critically ill account for about 2.5% of cases, and 1% of cases have been fatal. Severity and fatality rate aren't just a function of the virulence of the virus. The fatality rate will be higher among high-risk populations, which is why we must do all we can to protect the most vulnerable among us. Another cause of increased mortality is overwhelmed health services that are unable to provide intensive care to a high volume of critical cases. For this reason, we must all work to flatten the epidemic curve and protect the health system. Je rappelle aux Canadiens de tous âges de ne pas sous-estimer la gravité de cette maladie. Chaque citoyen canadien doit suivre les conseils de santé publique et tenir compte des graves avertissements lancés par d'autres pays qui n'ont pas eu la chance de commencer assez tôt ou de se battre assez fort. Nous devons tous suivre strictement les mesures d'éloignement physique, respecter les ordonnances de quarantaine et d'auto-isolement, ainsi que protéger et soutenir les personnes les plus vulnérables. I am reminding Canadians of all ages, do not underestimate the severity of this disease. Every Canadian must follow the advice of public health and heed the dire warnings from other countries who do not have the chance to start soon enough or fight hard enough. We must all strictly maintain physical distancing, comply with quarantine and self-isolation orders, and protect and support those who are most vulnerable. La Nouvelle-Zélande a introduit le concept consistant à prendre conscience de sa bulle et y rester. C'est un excellent moyen de conceptualiser la zone de protection que nous devons établir autour de nous pour empêcher le virus de nous atteindre. La protection optimale est assurée lorsque chaque personne s'isole dans sa bulle, laquelle fait 2 mètres de circonférence autour. Cependant, pour les couples, les familles et les personnes en situation de cohabitation, cette bulle peut inclure 2, 4 ou 6 personnes, toutes isolées dans une bulle où personne d'autre n'entre. Quelle que soit votre situation, restez dans votre bulle. Et s'il vous plaît, n'en sortez pas, ne faites pas éclater la bulle de quelqu'un d'autre. New Zealand has introduced the concept of knowing and staying inside your bubble. This is a great way to conceptualize the zone of protection that we need to have around us to keep the virus out. The optimal protection comes when each person has their own separate bubble that is a 2-meter circumference around us. But for couples, families, and other cohabitation situations, that bubble might mean 2 or 4 or 6 people, all keeping within a bubble that no one else comes into. Whatever your situation is, stay in your bubble. And please, don't step outside of it and don't burst anyone else's bubble. Thank you. Merci.
Okay, thank you very much, Dr. Njoo. Jean-Yves?
Merci, Chrystia. Ce qui arrive présentement à l'économie canadienne ressemble à un avion qui est pris dans une tempête majeure. Et dans ce contexte-là, l'objectif principal, c'est de faire atterrir l'avion en faisant en sorte que ses passagers soient en sécurité. C'est exactement ce qu'on a fait il y a 2 jours avec la prestation canadienne d'urgence, une mesure qui protège les travailleurs, qui fait en sorte que lorsque l'avion atterrit, les travailleurs atterrissent aussi en sécurité et en santé. C'est pour donner 2 000 $ par mois aux travailleurs pour faire en sorte qu'ils puissent à la fois prendre soin de leur santé et de la santé de leurs proches, mais aussi de leur sécurité économique pour qu'ils puissent mettre du pain sur la table. L'annonce d'aujourd'hui, c'est l'étape suivante, c'est protéger l'intégrité de l'avion lui-même. L'avion économique est extraordinairement important pour préparer la relance qui va venir un jour. On a besoin de sécuriser l'intégrité de cet avion, c'est-à-dire, entre autres, de protéger le moteur central de l'économie, qui est les PME. Les petites et moyennes entreprises sont le moteur de croissance de notre économie. Et c'est pour ça que l'annonce de ce matin, ce qu'on appelle en français le compte canadien d'urgence pour les entreprises, est tellement important en mettant des prêts garantis rapidement accessibles par les banques et le mouvement Desjardins pour ces PME au cours des prochaines semaines et des prochains mois. La deuxième mesure, tout aussi importante, c'est la subvention salariale de 75 % de la masse salariale des entreprises qui ont envie de continuer à travailler et à engager des travailleurs, mais qui ont besoin de liquidité, ont besoin d'argent pour maintenir à la fois le lien d'emploi, mais aussi les salaires qu'ils puissent verser aux travailleurs. Donc, ces mesures majeures ce matin sécurisent l'avion pour que, lorsqu'on sera rendu au redécollage dans quelques semaines, bien que ce redécollage puisse se faire en ayant un avion économique qui est intact, qui fonctionne, et les travailleurs qui auront été sécurisés et dont on aura pris soin au cours des prochaines semaines et des prochains mois.
Okay, thank you very much. We're ready to take your questions now.
Bonjour, merci. On va commencer par 3 questions au téléphone. One in French, one in English. Opérateur.
Thank you. Merci. We will now take questions from the telephone lines. Nous allons maintenant passer à la période de questions. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, notre première question, is from Micheline Laflamme avec Radio-Canada. Please go ahead. Your line is now open. À vous la parole.
Merci. Madame Freeland, est-ce que les discussions que vous avez eues concernant les militaires américains à la frontière sont maintenant terminées? Avez-vous eu des assurances du gouvernement américain que cette idée a été écartée?
C'est pour les Américains de faire les annonces concernant leur décision. Mais je peux dire que hier et aujourd'hui, on a continué de discuter cet enjeu avec nos voisins et nos alliés américains. Je pense et j'espère que nos voisins et nos alliés étaient à l'écoute. La position du Canada était absolument claire et absolument ferme. On a expliqué que, de notre point de vue, avoir les militaires sur la frontière canado-américaine n'est pas nécessaire et que pour nous, une mesure comme ça endommagerait notre relation bilatérale. I'll repeat that in English. So it is really for our American neighbors and allies to make announcements about their position. Having said that, we have continued our discussions very energetically. Yesterday and today, I was in touch last night and this morning with our Ambassador Hillman to the United States. Canada has continued to express clearly and forcefully its view that there is no logical reason to militarize our border with the United States. And we have been very clear also that such an action would damage our relationship.
Merci. Ma deuxième question s'adresse au Dr. Njoo. J'aimerais savoir qu'est-ce que le gouvernement ou qu'est-ce que vous faites pour aider les provinces à accélérer le processus d'analyse des tests. On voit des écarts très grands entre différentes provinces. Là, en Ontario, il y a 10 000 personnes qui sont en attente. Alors, qu'est-ce que vous faites? Et aussi, à la lumière de ce que vous voyez en ce moment, croyez-vous que les mesures qui ont été prises jusqu'à maintenant pourraient aider à aplatir cette courbe?
Merci pour la question. À l'échelle technique, Dr. Tam et moi, on travaille étroitement avec nos homologues des provinces et territoires, les médecins hygiénistes en chef de toutes les provinces et territoires. C'est un enjeu important. On continue à travailler pour aider les provinces avec leur capacité pour analyser les échantillons pour le COVID-19. À date, on sait que la capacité est quelque chose qu'on peut aider avec l'achat, on dit en gros, des ressources comme les écouvillants, aussi des choses importantes pour les analyses dans le laboratoire. Mais aussi, dans notre voie, on continue aussi avec l'accélération de l'évaluation des autres technologies. Par exemple, on dit en anglais point of care, le rapid test, les dépistages rapides. C'est aussi quelque chose, on travaille avec nos collègues à notre laboratoire national de microbiologie, parce que si on veut utiliser une autre nouvelle technologie, c'est aussi important, c'est valider. Parce que c'est pire si on utilise une test, une analyse qui n'est pas, comme dit, fiable, et si on peut avoir peut-être des résultats fausses négatifs, fausses positifs. Donc, c'est important de faire le travail d'une manière d'assurer que si on utilise une autre technologie, c'est une technologie fiable. Et aussi, on continue aussi à travailler dans une autre voie, une autre composante, aussi à regarder l'utilité des autres technologies, comme on a dit en anglais, la sérologie. Donc, avec tous les moyens, on travaille étroitement pour assurer que tous les Canadiens vont avoir l'accès au dépistage nécessaire.
Merci. Prochaine question. Next question.
Thank you. Merci. Our next question, notre prochaine question is from Janice Dixon with the Globe and Mail. Please go ahead. À vous la parole.
Hi, my question is for Deputy Prime Minister Freeland. I'm wondering if you can tell me if Canada knew that the U.S. would deport asylum seekers turned back at Canada's border when it struck a deal last week.
Thank you for the question, Janice. That is an issue which we are currently discussing urgently with our American partners. It is very important to Canada to abide by our international commitments, very much including when it comes to refugees. We are aware of the problems of refoulement, and it was and continues to be important for Canada to have assurances that that would not happen to people returned to the United States. So this is an issue which we are urgently discussing now.
Would Canada consider reversing the policy again if there is evidence that the U.S. is going to deport those people?
I always think negotiations are best conducted in private, and I don't like dealing in hypotheticals. But let me be clear about Canada's position, which is it is important for us to abide by our international commitments when it comes to the treatment of refugees, and we are very alive to concerns around refoulement. Thank you.
Thank you. Merci. Our next question.
And we were clearly alive to those concerns at the time that these agreements were announced.
Thank you, Deputy Prime Minister. Next question on the phone, please, before we turn to the room.
Thank you. Merci. Our next question. Notre prochaine question is from Lena Dibb avec la presse canadienne. Please go ahead.
Oui, bonjour. Moi, j'ai une question à propos de l'annonce d'aujourd'hui. Je croyais que la PCU, il y a 2 jours, allait assurer le maintien du lien d'emploi entre l'entrepreneur et ses employés. Alors, pourquoi est-ce qu'il vous a fallu aujourd'hui faire ça et c'est 75% de subventions pour les PME pour maintenir le lien d'emploi? Est-ce que c'est pas ce que la PCU devait faire?
Peut-être Jean-Yves peut répondre en français et je vais répondre en anglais. OK? Jean-Yves, est-ce que tu veux commencer?
Merci pour la question et vous avez tout à fait raison. La PCU, telle qu'annoncée mercredi, permet toujours le maintien du lien d'emploi parce qu'on sait à quel point ce lien d'emploi est non seulement important dans les conditions de précarité et d'anxiété que vivent les travailleurs présentement, mais important aussi dans le contexte futur que l'on va vivre où les entreprises vont vouloir ramener au travail les travailleurs. Ce qui est annoncé ce matin, ça va au-delà. En plus de maintenir le lien d'emploi, les entreprises vont aussi pouvoir maintenir leur capacité de verser des salaires aux travailleurs au cours des prochaines semaines, dans les conditions dans lesquelles se retrouvent les entreprises. Une subvention de jusqu'à 75% des salaires va permettre à nouveau non seulement de maintenir le lien d'emploi, mais de maintenir le travail de ces travailleurs et de payer les salaires qui vont avec.
And if I could just add, today's announcement by the Prime Minister on the 75% wage subsidy was a very important announcement. As Jean-Yves has said, our government, the Prime Minister, understand very much the seriousness of this situation. We understand, as we heard from Dr. Njoo just now, that the health situation is likely to get worse before it gets better. And we understand that the economic impact is serious. And so we know that the government has a duty to do whatever it takes to allow our economy to weather the storm. By committing to a 75% wage subsidy, the government is taking a major step to help small businesses get through this intact, and it is taking a major step to do something which is so important for Canadians, and that is to keep that connection with their employer. So important to know that you have a job right now, even if the conditions of physical distancing are making it hard to go to work, even if those conditions are making it hard for your company to operate as usual. We get that, and that is why the Prime Minister announced this essential step this morning. And I would point out that the Prime Minister made clear that these measures will be retroactive to the 15th of March. And we very much hope that companies will take that into account and will hang on to their employees and will perhaps bring back people they were thinking of laying off. We're all in this together, and it is so important to keep our economy strong. We acted earlier to be sure that individual Canadians were not penalized for doing the right thing and staying at home to socially distance because of the coronavirus. The measures today are about being sure that Canadian small business is not penalized and indeed has the resources that it takes to weather this storm. And I do also want to say, this is a difficult situation. We can't mince words about that. And it is certainly going to get worse before it gets better. But what the Prime Minister said this morning is a further assurance to Canadians that our government will do whatever it takes to keep Canadians healthy and safe and to keep our economy intact during this situation and to ensure that economically we are in a position to come roaring back when the health crisis has abated. Canada has the ability to do that. We have an exceptional healthcare system. We have a very strong federal fiscal position going into this crisis, and we are going to use that position to be sure that Canadians weather the storm and that we are all in good shape and able to shovel our way out when we are able to leave our houses and get back to work.
Et ma question suivie, il y a 2 jours, vous avez dit que la PCU allait permettre aux entreprises de ne pas mettre les gens dehors, mais de simplement d'arrêter de les payer et que Ottawa donne donc directement l'argent à ces gens qui se retrouvent encore employés, mais sans revenus. Maintenant, vous changez votre tactique. Est-ce que c'est parce que les entreprises ont refusé de faire ce que vous leur demandiez il y a 2 jours, de garder les gens à leur emploi sans les payer? Et mon autre question, c'est pourquoi vous arrêtez aux PME? Ce qu'on voit, les mises à pied ces derniers jours, c'est dans des grosses entreprises, je pense au Cirque du Soleil et à beaucoup d'autres. Alors, pourquoi seulement vous arrêtez aux PME?
3 choses importantes. La première, c'est le cadre général. Là, on est en train de faire atterrir un avion où il y a des passagers précieux, les travailleurs qui doivent être protégés, et c'est l'objet de la prestation canadienne d'urgence qui a été annoncée mercredi. La deuxième chose, c'est qu'on veut que l'avion lui-même, le moteur et les ailes, soient protégés pour pouvoir relancer l'économie dans quelques semaines, et c'est exactement ce que l'annonce de ce matin fait. L'annonce de ce matin fait, elle met à la disposition des PME un fonds d'urgence que les entreprises pourront utiliser pour emprunter jusqu'à 40 000 $. Le ministre Morneau, dans quelques instants, va donner davantage de détails. Et l'objectif, c'est que le tissu PME fondamental à la croissance future de l'économie soit disponible lorsque l'économie va être relancée. C'est absolument essentiel que nos PME soient protégées dans le contexte actuel, et c'est pour ça que le fonds qui a été annoncé ce matin, le compte qui a été annoncé ce matin, est si important pour dire aux entrepreneurs au Québec et ailleurs au Canada, on est là pour vous, on vous entend, vous allez avoir de l'appui pour vous protéger au cours des prochaines semaines, pour qu'on puisse compter à nouveau sur vous lorsqu'on va relancer l'économie dans quelques semaines. Et la troisième chose, c'est qu'il y a une complémentarité entre les deux. Les compagnies ont besoin de travailleurs, les travailleurs ont besoin de compagnies pour que l'économie puisse bien fonctionner. Alors, c'est pour ça que les 2 mesures sont complémentaires. On sait que des compagnies ont déjà annoncé à leurs travailleurs que le lien d'emploi allait être maintenu, mais qu'elles ne pourraient pas, en l'absence de l'annonce de ce matin, continuer à les payer. Alors, ce qui se passe ce matin, c'est que les compagnies qui en sont capables vont pouvoir rappeler au travail plus rapidement les travailleurs qui ont déjà été pas mis à pied parce que le lien d'emploi est toujours maintenu, mais qu'on a envoyé à la maison et qui ne reçoivent plus de salaire. Les compagnies vont pouvoir les rappeler rapidement si les conditions le permettent et le demandent. Et en plus, les compagnies qui auraient autrement mis des travailleurs sans salaire, ces compagnies, ce qu'on leur dit ce matin, c'est que 75% des salaires qui vont être payés par le gouvernement canadien. Donc, réfléchissez rapidement. Sachez qu'on va être là pour vous aider au cours des prochaines semaines. Il y a 75% des salaires qui vont être couverts par le gouvernement canadien. Donc, vous avez cette possibilité non seulement de maintenir votre relation avec vos employés, mais aussi de pouvoir, au cours des prochaines semaines, continuer à les garder actifs et continuer à les payer parce qu'on est là pour vous protéger, vous, comme entreprise, et on est là pour protéger aussi les employés dont vous avez tellement besoin non seulement peut-être à court terme, mais certainement à plus long terme.
Yeah, I'll just add a couple of sentences in English on that. I think it's important to see the very strong measures announced by the Prime Minister this morning as complementary to what we have already done. The first step economically taken by our government, quite rightly, was about protecting individual workers, individual Canadians. And it was above all about ensuring that there was no economic reason for people to avoid doing the hard and necessary action of social distancing and of staying home if they were unwell, if their children couldn't go to school, if they needed to care for people who needed to stay home because of coronavirus. We understood that we were asking Canadians to do something that is not only socially hard, but that could have borne a real economic penalty for a lot of people. So it was important to act really swiftly to put some measures in place so that Canadians knew that doing the right thing on the health front would not hurt them economically, and to support all those Canadians doing that. The strong action the Prime Minister has announced today is very complementary to those steps and is all about ensuring that our small businesses, the backbone of our economy, are able to get through this intact, viable, still connected to their employees, and that when this period of social distancing comes to an end, as it inevitably will, that our economy is in a position to come roaring back and that Canadians still have their jobs. That's what the Prime Minister announced today, a very, very important step, and it should give Canadians a lot of confidence that the government is prepared to do whatever it takes to keep our economy strong.
Merci, Madame la Vice-Première Ministre. We'll turn to the room. Rachel Haynes, CTV.
Ministers, Rachel Haynes from CTV. My first question for Dr. Njoo is about national guidelines for hospitals who are going to be experiencing or expecting to experience a lot of critically ill patients coming to hospitals over the next few weeks. We've seen a lot of deaths across the world, and a lot of families too are reaching out about critically ill patients whose families are on ventilators and they're not able to be by their side given the measures that are in place right now. Are there going to be national guidelines sent out to hospitals to deal with this reality, or will Canadians have to face the fact that they may not be able to be with their loved ones at this time?
Thank you very much for the question. This is among the many live issues we're actually dealing with at what we call an FPT, or federal, provincial, territorial level. As I said again, in terms of my level, in terms of public health, the Special Advisory Committee is meeting practically on a daily basis to look at this issue and others. We recognize that provinces, the provincial officials, are each looking at their own individual plans in terms of the healthcare system, what the needs may be. There's a lot of modeling and projection going on in each of the provinces and territories, and we are sharing that information at the table nationally, so we can compare our experiences and look at what the issues might be that we could exchange best practices. So in terms of a national approach, we recognize that each of the provinces and territories do what's necessary in their jurisdiction, but we at the federal level are always there to support and assist in terms of looking at ways we can support in terms of surge capacity, also in terms of what we can do to help out provinces that may not have the same capacity as maybe some of the other ones, because each of the provinces at the present time is that you say is a different part of the pandemic curve. Some provinces are harder hit at the present time, and others are maybe not as far along, but certainly we need to anticipate and plan for that possibility in those provinces as well. So at the end of the day, we are looking at frameworks and approaches so that, as you say, at the end of the day, all Canadians across the country will have access to the healthcare services that they need.
Okay. My question was more about families who would like to be with their loved ones. If their loved ones are in hospital, how can you visit them? And is that a reality now that you're just not going to be able to see your family? But I would also like to follow up on the testing that you said, is that you said that we have one of the highest rates of testing in the world right now. But there are results backlogs of about 10, 11, 12 days that we know of. So why, is it so important that you're promoting these numbers of tests, but we are not seeing the results. So how is that a good thing that we have all these tests, but we don't have any results yet?
Okay, so to the first question, as we all know, physical distancing is the most important measure we have in place right now to prevent further transmission of the virus. So certainly at a local level, we can appreciate it's very difficult for families that have a loved one that's in a hospital receiving care. And so I would defer to the hospitals. Obviously, they're putting measures in place. I think many hospitals have limited or basically said, no, there's no visitors allowed. People, I think, understand that the need to be able to protect other patients and also the staff in the hospitals from potential further exposure to the virus. And I think the message we've been giving loud and clear is that everyone should stay home. You only go out for essential activities such as buying your groceries. So I think with that principle in mind, I think people understand, get it, why we shouldn't have, let's say, visitors in hospitals. To your point about the testing, we have one of the highest testing rates, and the results I've been giving you are the testing results. So we know there are a lot of tests that are still in play, as they say, that are still waiting to be analyzed. And of course, we can do better. And I think the provinces are stepping up. I'm aware, for example, the province of Ontario, Quebec as well. They're all stepping up in terms of their capacity, in terms of how you say a faster throughput, if I can put it that way. But in terms of the faster throughput, as I mentioned earlier, it's based on the current technology, the gold standard, which is still the PCR test. So that's with the swab, sending the swab in, the sample, they get analyzed with a PCR machine, etc. The other things we're looking at is that are there other testing modalities we can also use? So, for example, we're talking about point-of-care tests that also would be able to give results in a much shorter time and also be closer to where the care is actually being delivered. As was mentioned earlier, these types of tests, if they become available, and we hopefully expect sooner than later, will be a godsend for certain types of situations, for example, in remote and isolated communities, that will also decrease the testing time. Because right now, with the current technology, they have to send the samples. You can imagine physically by an airplane to go down to a reference laboratory to get that test result. So we're looking forward to having that kind of technology available as well. But that takes a bit of time. And as I mentioned, I think in French earlier, we need to validate those tests, because there's nothing worse than having a test out there that doesn't give you what we call valid, accurate results. There's nothing worse than being sort of falsely reassured and not knowing if you have a false positive or false negative test results. So we need to have those tests validated before we're able to roll those out across the country. And then finally, as I mentioned before, there's also serological testing, which would be another, as they say, tool in the toolbox, not to use too many sort of things like that, anecdotes, but it'd be another technology we would have in our suite of testing technologies. So with all those things on the go, as I said before, in terms of even the increase in our testing results, look how we've increased over the past few days. And if you look at countries around the world, by sort of what I understand, we're like number 2 or 3. I think it's only the United Arab Emirates and I think South Korea that had a higher testing rate per million population than we do. We're about the same as Australia right now.
Thank you, Doctor. Next question, Julie Van Dusen, CBC.
Hi, it's either for Ms. Freeland or peut-être Monsieur Duclos, I'm not exactly sure. But so your government brought in the emergency benefit that's going to give people $2,000 for 4 months. So I'm assuming you chose 4 months because you think it's going to last 4 months, the pandemic, but I'm not sure. The PBO, his report today, he estimates that this will go on for 6 months until August. So what timeline is the government planning for that we will live like this?
So I'll start, and I am actually going to ask Dr. Njoo to offer some comments because that is really a question about public health. And let me just say this. We do know that the health situation is going to get worse before it gets better. And all of us at the federal level, provincially, in cities, in hospitals across the country, are preparing incredibly energetically for that inevitability. All Canadians are working really hard to make that worst case scenario as least of a worst case as possible for Canadians. And every single person who is physically distancing, every single person who is making the big sacrifice of not visiting a parent or a grandparent in a long-term care facility, every child who is not going to school is contributing to a better health outcome for Canada, and a better health outcome will mean a better economic outcome. In terms of how long this will last, I would love, Julie, there is nothing I would love more than to be all over. But it's so important to be honest with Canadians, and it's important for all of us to live in the truth with this situation, and only by being honest with each other are we going to get through it. And being honest with each other means those actions we're taking to keep Canadians healthy, safe, and alive do not hurt our economy and don't hurt individual Canadians. So that is what we're doing. And I will leave it to Dr. Njoo perhaps to offer a bit more of a health perspective. We're looking at a lot of scenarios. Provinces are looking at a lot of scenarios, and our healthcare scenarios are very much connected with the economic thinking that we are doing. It's one reason why you're seeing the economic thinking developing, why you are seeing new proposals coming out very regularly, because this is an evolving situation. Dr. Njoo, and then maybe Jean-Yves would like to add something. Ça va?
What I can say is that from the public health perspective, there's tremendous global collaboration. We're in regular contact, Dr. Tam, myself, and others, with the World Health Organization, with our partners internationally, such as the CDC in the United States. We're constantly sharing information, best practices, looking at the experience of what's happened, what's worked, what hasn't worked in other countries, the changing epidemiology, looking at the science and the evidence, and using, like I say, the best measure we have at the present time, which is physical distancing. And the reason for that is that we're trying to buy time. We talk about things like flattening the curve, planking the curve. It's all to buy time, to not overload our healthcare system. As scientists around the world, including ours in Canada, are working day and night to try and find that vaccine, that treatment that would help also lessen the burden of illness, both here in Canada and around the world. And I guess to your question, we're in it for the long haul. It's not going to be days and weeks. It's definitely months, many months. And the one thing that other countries are also looking at, and we're looking at as well, is there a possibility of a second wave? Who knows? I think Dr. Tam mentioned it. I would agree with her. We're looking at all possibilities and planning for all potential scenarios.
So briefly, I would just add that despite the uncertainty that we all see, both on the health side and on the economic side, we really need to, and I say we, the federal government as well as all governments, we need to demonstrate to Canadians that we are there to help each other and that we are there to provide the hope that we need to go through this crisis. And that hope is better supported when Canadians understand that from certainly both a health and an economic perspective, we'll be there to support them. So this morning's announcement is exactly that. We're going to support you, both the workers and the small and medium-sized businesses and everyone else important in our economic fabric, because we all need to go through this together. So confidence and feeling that we're all there to support each other are key, not only messages, but key actions, items that we are again delivering today.
Dr. Tam, my second question flows out of what you've just said, and that is, you've repeated often that it's going to get worse before it gets better. What do you mean by worse? What does that look like? And what's being done to prepare for a surge, I'm assuming?
So we always prepare for the worst, but hope for the best. In terms of the worst is that we've already seen experience in Quebec, where they've had a spike in cases. Part of it, I think, and I've been communicating closely with colleagues in Quebec, is due to the fact that they've decentralized their testing. So before, it was all the laboratory results had to be verified at sort of the provincial lab level. Now I understand there's a network of 10 laboratories, so they're able to actually do the testing and have the results come out sooner. They're also saying that part of the spike is because Quebec, compared to the rest of Canada, their March break was earlier. So I think it was at the beginning of March. And therefore, we're now seeing, as we always know, because of the delay in terms of people having been exposed, and then now we're getting the results of people who become ill and get their test results. That's why that explains in part the spike of cases in Quebec. So in terms of the worst, as we know, Ontario had their March break a week later. We, I think on Friday 13th, March the 13th, told Canadians, hey, avoid all non-essential travel outside of Canada. Many people before, maybe just, even during that time, were still going on their vacations outside of the country, etc. We also have the snowbirds, etc., and many other Canadians around the world. And we know that there's an increased risk of exposure to COVID-19 in many parts around the world. So with these people now coming back, we're telling people physical distancing is so important, but it remains to be seen what comes of it in terms of these people maybe becoming ill with COVID-19 and then seeking medical care, getting tested, and getting those results. So that's what we might anticipate as sort of being the worst. And then hopefully now with everyone understanding the absolutely critical importance of physical distancing, that hopefully in the weeks to come we will see the effects of that positive measure. The other point maybe I'll make at this point, because I understand there are some questions that have been out there in terms of the mandatory order under the Quarantine Act that came into effect, and maybe I'll just want to walk people through that, because I know there's been maybe some confusion in terms of quarantine, self-isolation, what happens to travelers coming back. So I'd like to maybe unpack that to make it crystal clear to all Canadians. That's the next step in terms of making sure that we don't add to the surge. The surge might be what happened a few weeks ago, and the measure we're putting in place is to prevent an even a further increase in that surge. If you'd like me to get... Okay, so with the mandatory order under the Quarantine Act, all travelers coming to Canada now are subject to an order of quarantine, and that's a serious issue, and certainly that's a very strong measure that our Minister of Health, Minister Haidu, put in place on March 25th. And so the easiest way to look at it is that you have people who come to Canada who might be ill with symptoms, maybe arriving at a land border, or maybe even by air, even though they could or should have been checked before they boarded their flight. And of course, what we call travelers coming back who have no symptoms and look and feel well. So the ones who are ill, that's straightforward. It's always been in the Quarantine Act. If you have an ill traveler at the border, certainly with our quarantine officers, we would take charge of these people, make sure they get the appropriate medical follow-up, isolation, make sure that we do it in the best interest of their health, and also obviously to protect Canadians here in Canada. I would remind people also that it's in everyone's best interest, including the traveler, to declare if you're not feeling well at the border. I've heard stories about people maybe hiding symptoms, etc. I can give you an anecdote. There was an individual, not giving away any sort of medical confidentiality, that arrived at the border, wasn't feeling well, was taken into quarantine, and in a number of several hours later, deteriorated rapidly and is now in an intensive care in a hospital. So it was good that that person was honest and told us about their symptoms. So that just gives you an example of the seriousness. Now we're saying that for asymptomatic travelers who come to Canada, get home as fast as you can. If you're asymptomatic, you're still well, the direction is go home as quick as you can by the most direct route. Do not stop for groceries. Just get home. If that means an onward travel with a domestic flight, we will give you a mask and make sure that you get home safely. And once you're home, you are under quarantine. That means you stay home. If you have a property, you want to get some fresh air and you have a balcony or your backyard, yes, you can go out there, but that's it. No bike rides, no walking around in the neighborhood. You are under quarantine. I don't know how much clearer I can make it, but that's it. So that's really what we're putting in place, and I hope Canadians and everyone understands that is the expectation requirement under the Quarantine Act and the order that's been put in place. Thank you.
I just want to add one thought, Julie, to your question about a surge, which is, talking about surges talking about the reality, which is this will get worse before it gets better, can make people feel powerless. And if you are home, physically distancing in your house, maybe your children are home with you, you can feel even more powerless. And that is not how we should be feeling. Canadians should be feeling very powerful. And Canadians should be feeling powerful because each one of us can make a really significant contribution to our country getting through this and to our country avoiding the kinds of really nightmarish situations that we've seen in countries like Italy. And we can make that contribution by doing what Dr. Njoo has described, by being really rigorous in practicing physical distancing. Now, that is hard for individual Canadians, and it is hard for Canadian companies. And that's why what Jean-Yves said is absolutely the case, which is the government is here to get us through this. We will provide whatever economic support is necessary for Canadians to do what it takes to get through this global pandemic. So I want people to be realistic, to do the hard things each individual Canadians need to do, but also to be hopeful, to feel very powerful, and to know that we are going to get through this because we are a country that knows how to act collaboratively and that knows how to listen to our experts.
Okay, so maybe one last question from the room and one last question from the phone. Mike, Global.
Dr. Njoo, when the millions of items came from wherever, the PPE equipment that we were talking about yesterday, when is it actually going to get here? You know, we were supposed to be sent millions of extra things from PPE from China and elsewhere. Has it shown up, or when is it going to show up?
Well, there's quite a range of equipment that certainly that's been ordered. We're working day and night, obviously, with our provincial territorial colleagues to get the equipment into Canada, and I can't give you an exact time or date for all of the various pieces and types of equipment, but rest assured that we're looking across the globe and also obviously in Canada to ensure that we do have the supplies equipment we need here in Canada.
For hospitals who are running out of PPE, what is the situation there? And can we guarantee that frontline healthcare workers are getting the protection?
We recognize that the frontline healthcare workers, all frontline workers who are at risk of exposure due to dealing with sick patients, they need the PPE. And so I could say we're working. Right now I understand, yes, that there are, for those who need it, are frontline healthcare workers, and not for someone to put on their face if they're going to the grocery store to get their groceries. So I can't stress that enough.
Okay, one last question for the phone. For those who are still on the line and want to stay on for the next press conference by Minister Morneau, please do. You don't have to redial in, but we'll take one more question on the phone.
Thank you. Merci. Our last question is from Mary Bastel avec Le Devoir. Please go ahead. À vous la parole.
Oui, bonjour, M. Duclos. J'ai quelques questions sur la décision de fermer les bureaux de Service Canada. Juste être sûr, vous m'entendez?
Oui, Mme Bastel, nous entendons.
Donc, sur les bureaux de Service Canada, M. Duclos, il y a des gens qui sont inquiets ce matin d'entendre que les bureaux seront fermés alors qu'il y a déjà énormément de demandes d'aide qui ont été acheminées au gouvernement. Comment ça se fait que c'est pas considéré un service essentiel dans le contexte où on se trouve?
Bien, merci, Mme Bastel, de votre question. Alors, si je peux répondre de manière générale en premier, puis ensuite aller plus dans les détails. Donc, de manière générale, ce qu'il faut absolument faire, c'est de servir les Canadiens qui en ont besoin. Et ça implique évidemment des services qui sont offerts par Service Canada. Mais le deuxième objectif, c'est aussi de protéger la santé et la sécurité des employés de Service Canada. Il y a eu au cours des dernières heures et des derniers jours des incidents par lesquels, malheureusement, des employés de Service Canada ont vu leur santé et leur sécurité en danger. Et comme tout employeur responsable, quand ce genre de circonstances se produit, l'employeur doit répondre de manière à protéger cette santé et cette sécurité de ses employés. Alors, ce qui se passe, c'est que les services de Service Canada continuent à être offerts aux Canadiens de 4 manières. Un, en augmentant significativement le nombre d'agents qui s'occupent en particulier des demandes de prestations d'assurance-emploi. C'est plus de 1000 employés qui ont été redirigés vers la gestion des demandes de prestations d'assurance-emploi. La deuxième chose, c'est en s'assurant que les employés puissent travailler dans des environnements sécuritaires, en offrant des mesures là, appropriées, que ce soit par Internet ou par téléphone, pour que les gens puissent recevoir les services auxquels ils ont droit. La troisième chose, c'est de faire en sorte que certaines personnes qui ont des difficultés plus importantes en termes d'accès à ces services pour des raisons de mobilité ou pour des raisons de handicap particulier, que ces gens puissent avoir accès à des prestations de services appropriées à leurs conditions. Et ça se fait de manière à la fois responsable, mais aussi respectueuse. Et la dernière, c'est qu'on va continuer à s'assurer que les demandes de prestations d'assurance-emploi qui ont déjà été faites depuis le 15 mars puissent se déplacer vers la nouvelle prestation canadienne d'urgence pour faire en sorte que les gens n'aient pas besoin de faire le suivi de leur demande de prestation d'emploi, d'assurance-emploi, faire en sorte que ces demandes cheminent naturellement, facilement et efficacement vers cette nouvelle prestation canadienne d'urgence que nous avons annoncée mercredi. Donc, en gros, si je résume, on protège à la fois la santé et la sécurité des agents de Service Canada et on s'assure aussi, avec l'annonce qui a été faite mercredi et avec les services additionnels que je viens de résumer, on s'assure aussi que Service Canada puisse livrer les prestations et les services auxquels les Canadiens ont droit en temps normal, mais certainement en temps de crise aussi.
Merci, mais en suivi, vous dites donc cette série de mesures qui, selon vous, vont accélérer l'accès à ces prestations-là, mais vous parlez notamment des 1000 employés qui ont été de ESDC qui ont été redirigés vers le programme d'assurance-emploi, mais ça, c'était déjà le cas dans les derniers jours avant que vous fermiez les centres de Service Canada. Donc, est-ce que vous allez mettre plus de monde au téléphone ou d'une autre manière pour aider les gens qui peuvent plus aller au centre de Service Canada demander ces services-là? Et mon autre question, c'est en vertu de votre projet de loi C13, il semble qu'il est interdit de demander la prestation d'urgence si on a quitté volontairement notre emploi. Or, les gens nous disent peut-être que quelqu'un a quitté pour s'occuper de son enfant parce que la garderie est fermée, ou quelqu'un a quitté parce qu'il se sentait pas en sécurité d'aller travailler alors que la santé publique dit justement de rester à la maison. Qu'est-ce que vous dites à ces gens-là qui ont l'impression qu'ils pourront pas demander la PCU parce qu'ils ont quitté volontairement leur emploi? Est-ce que vous comptez clarifier cette situation-là?
La réponse est oui à vos deux questions. La première question au sujet des services de Service Canada, en raison de la fermeture physique des locaux, en raison de l'incapacité pour les agents du Service Canada de recevoir les gens en personne, ce qui se passe, c'est que du temps et des ressources additionnelles sont maintenant disponibles pour répondre aux appels et pour traiter les demandes en ligne. Il y a une très grande majorité de ces demandes qui sont soumises en ligne et donc le fait que les agents soient moins en contact physique avec les Canadiens leur donne plus de temps pour recevoir les appels et traiter les demandes par Internet. Et la deuxième question au sujet des normes et des conditions pour recevoir la prestation canadienne d'urgence, des précisions ont déjà été fournies, mais il y a beaucoup d'autres précisions qui vont être fournies au cours des prochains jours. On entend très bien non seulement l'intérêt des Canadiens pour cette nouvelle prestation, parce que je pense que les Canadiens comprennent là, que c'est une prestation qui est mise en place dans un cadre d'urgence, dans un cadre de crise. On n'a jamais vu un gouvernement canadien dans l'histoire du pays, certainement pas depuis la Deuxième Guerre mondiale, mettre en place de telles mesures d'urgence. Donc on le fait à la vitesse grand V. Les Canadiens et les Québécois en particulier posent normalement, et c'est tout à fait légitime, des questions importantes. Il y a encore beaucoup de ces questions auxquelles on doit apporter des réponses. Ce n'est pas juste des réponses, mais c'est les bonnes réponses, et on aura ces bonnes réponses prochainement.
Merci. Ceci met fin à la conférence de presse. Comme je l'ai dit, s'il vous plaît, restez en ligne si vous voulez assister à la suivante. Thank you. Merci.